Good day, folks. Thank you for joining us here at Your Health. Say, are you one of the 60 million Americans that suffer from osteoarthritis, living your life in chronic pain, thinking nothing can be done about it? Well, there are natural agents that can provide you relief. Glucosamine, chondroitin, and MSM are the topics of our discussion today. If you want some help with this, you can get it, but you have to become proactive. That's our concept for today, osteoarthritis and the natural remedies that will help you. But first, let's go to our news. Let's see what's happening in the health world. Dietary changes can improve migraine headaches. Researchers from the University of Cincinnati reviewed 180 previous studies on the subject of diet and migraines. They found dietary practices can have a major impact on both the severity and frequency of headaches. The review found that caffeine use, food additives such as MSG and nitrates, along with alcohol consumption, can all cause worsening of migraines. The study was published by Headache, the Journal of Head and Face Pain. Well, folks, the authors report that if you usually have 3 or 4 cups of coffee every day and then on the weekend you skip coffee completely, well, you've just set yourself up for a major migraine headache, and on your weekend off nonetheless. On the other hand, if you rarely drink caffeinated beverages and then drink 2 or 3 cups of coffee, you may also trigger a migraine. So caffeine use, too little if you're a regular user or too much if you never use caffeine, can both lead to migraine. They also found considerable evidence that food additives play a major role in triggering migraines. Foods with monosodium glutamate, or MSG as it's commonly called, are notorious headache inducers, but also nitrates added to processed meats for their preservative properties. They can also initiate a migraine. MSG and nitrates are common headache triggers, but almost any food or food additive can cause a migraine. Recently, we reported a study that found keeping a dietary diary over 90 days helps 9 out of 10 migraine sufferers discover which foods are triggering their headaches. Now, this study also found the typical migraine patient has 3 different foods on average that are making their headaches much more frequently and severe. Also, we learned from our new study today that the addition of omega-3s to your diet and supplement plan can provide major benefits for the migraine sufferer. The notion is the omega-3s help to provide brain and nerve cell membrane stability. In fact, the Federation of American Societies for Experimental Biology just published a study that found supplementing omega-3 fatty acids or eating fatty fish helps to improve the function of the brain's glymphatic system. The glymphatic is the brain's lymph system, and it's a system just recently discovered, and it works to detoxify the brain, so it stands to reason. Improve toxin removal from the brain and improve migraines. Bedtime use of electronic media devices increases the risk of sleep difficulties in children. Researchers from King's College London reviewed 20 previous studies involving over 120,000 kids ages 6 to 19 to find when children use smartphones or computer tablets near bedtime, it doubles their risk of inadequate sleep, poor sleep quality, and excessive daytime sleepiness. The authors of the study recommend that children turn off all media devices 90 minutes before bedtime. The study was published by JAMA Pediatrics. Related research from Uppsala University finds reduced sleep patterns reduces the number of beneficial probiotic intestinal bacteria, a pattern that has been associated with obesity and diabetes in previous studies. Researchers evaluated the effect of sleeping for only 4 hours a night for 2 consecutive nights on 9 healthy, normal-weight men. Well, folks, the use of electronic media devices such as smartphones or computer tablets during the 90 minutes prior to bedtime doubles the risk that a child will experience inadequate sleep time, poor sleep quality, and excessive daytime sleepiness. And fully 7 out of 10 kids and 9 out of 10 adults have such devices in their bedrooms. Now get this, the study also found even if the device is turned off, if it remains in the bedroom around bedtime, the child still has disturbed sleep patterns. There have been several proposed reasons for this pattern overall. Electronic devices are stimulating to the brain, causing continued arousal when children should be winding down for sleep. And of course, they all emit blue light that inhibits the production of sleep-inducing melatonin. Also, if the device is turned off but still plugged in, as it were, the device still emits electromagnetic waves known to affect biological tissues. Also, we learned from a study on adult men that even 2 consecutive nights of limited sleep leads to disturbed intestinal flora associated with obesity and diabetes. They also found after just 2 nights of poor sleep, the men showed a 20% spike in insulin resistance, the hallmark feature of adult-onset diabetes. And none of these men were diabetic. So yes, chronic sleep deprivation could absolutely lead to weight gain, metabolic syndrome, and eventually type 2 diabetes. And think about it. It could all possibly start with a child routinely using an electronic device during the 90 minutes prior to bedtime. You know, when our children were small, we read them a bedtime story from a book. Today on Your Health, we will discuss the remarkable osteoarthritis dietary supplements Glucosamine, Chondroitin, and MSM. Stay tuned. We'll be right back. You may have heard the saying, an ounce of prevention is worth a pound of cure. It's true. I'm Dr. Richard Becker.
And I'm Cindy Becker. Autumn is a time of transition. It's the perfect time to renew your dedication to healthy living. This September, we're excited to bring you our fall savings celebration here at BioInnovations.
Perhaps you've heard about the health benefits of supplements. In many cases, they can make a big difference.
During September, Dr. Becker's Spa Nutrients are up to 40% off. Noni Natural Skincare and Spa Therapy are 40% off. And Aloha, Noni, and Acai are still 50% off by the case. And you get free shipping with orders over $50 in the continental U.S.
This is a good time to restart a program of nutrition, exercise, and supplements because an ounce of prevention really is worth a pound of cure.
Order online or call 888-442-2128 and let BioInnovations assist you in making the right choices for better health. Ask about the AutoShip program for additional savings.
I'm Dr. Richard Becker, and this is Your Health at a Glance. Our health depends on the choices we make every day, and few conditions are as dependent on our choices as diabetes. So here is your daily diabetic checklist. Number 1, take your diet seriously every day. Eat lean protein and leafy vegetables. Number 2, sugars and starches raise blood glucose, so reduce them in your diet. Number 3, check your blood glucose and record the readings every day. Number 4, take your medication daily and don't skip. And number 5, try to exercise every day. It will help you take off weight, which will help your body regulate blood sugar better. If you are diabetic, this is your quick daily checklist that could make life better. For Your Health at a Glance, I'm Dr. Richard Becker.
Are you one of the 62 million Americans suffering from gastrointestinal problems? Do you struggle with other chronic conditions? That's why we offer Dr. Becker's Bionutrient Probiotics.
After years of research, we developed a revolutionary probiotic formula with gastrodefense technology. This system protects the good bacteria from stomach acid so the probiotics reach the intestines where they go to work. Additionally, we use live count technology to prolong the shelf life of the probiotics, so there's no need for refrigeration.
Dr. Becker's Bionutrient Probiotics is a powerful combination and one of the most effective formulas available today. And we offer a children's chewable formula too, both at prices you can afford.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128.
Welcome back, everyone. It's such a blessing to be with you today. Well, I've got to tell you, today's show is going to be amazing. We're going to learn all about how you can naturally support joint health. So many Americans suffer from joint pain, don't we? I mean, I think almost everyone over the age of, I don't know what to say, maybe even 40, 35, has some little ache that comes up, some pain, and there are things that we can do to actually keep our joints healthy as we age. You don't have to live in pain. Richard, I think when you were in practice, pain was one of the largest segments of our patient base.
Number one, and that's true from surveys, number one reason to see a doctor is you're hurting.
Exactly.
You're suffering and you're
that's
in pain.
No way to be.
It's affecting your life and you want help. And, you know, so many of us think, well, this is just part of getting older. There's really nothing that can be done. That's not true. It is part of getting older, but, you know, we can help this sort of thing. What we're talking about today is arthritis. Arthritis causes joint inflammation that results in pain, restriction of motion, joint space narrowing, deformity, and disability. This cascade of events results in you not being able to perform the activities of daily living, and that compromises your quality of life. We don't want that. We want to stay active for as long as possible and enjoy life. You know, I often think all those years of hard work, honey, through school, medical school, and practice, and with this program, and eventually you've accumulated a little security in your life, and you want to enjoy that. But if your life is racked with pain, it's hard to enjoy it. Even if you have a nice bank account and your home's paid for and you have grandkids and all the things that we dream about, living in pain, it certainly compromises the enjoyment of all those things. So we want to help that. Of these arthritic processes, osteoarthritis is the most common, but we also have autoimmune arthritis, such as rheumatoid arthritis, and chemical arthritis, such as gout. And they can all happen together. This is something that often shocks people. You can have the common osteo, and then all of a sudden you have rheumatoid as well, and then the gout flares up. So you're hurting for multiple reasons. It's estimated anywhere 60 to 70 million Americans have some form of some form of arthritis, and 50 million have doctor-diagnosed arthritis, and over 20 million live with chronic joint symptoms that have not been diagnosed. They just feel it's a part of life. And, you know, I think every doctor that's been on this program says at some point, if this subject comes up, pain is not a normal part of aging. And we should not accept that as a normal part of aging. Of course, most of us have pain as we age, but in the ideal setting, it's not part of getting old. Old age does not cause pain. So something's wrong if you're hurting. Now, of all these 70-some million people with arthritis in our country today, the vast majority of these folks have osteoarthritis, and it is the leading diagnosis in those with chronic disability. It complicates so many other conditions. Baby boomers are now at prime risk for osteoarthritis, and more than half of those affected with osteoarthritis are under 65. You don't have to be retired and elderly to have arthritis. I remember one young lady who at 17 was developing arthritis. Now, can you imagine what this young person will be like when they're 65 and 70 if they don't do something to help themselves? It'd be a tough go, wouldn't it? Half of the Americans with arthritis don't think there's anything that can be done, and 40% never tell their doctor that they're in pain. Maybe it's because they don't tell their doctor about this problem because they know all the doctor will do is hand them a prescription for an anti-inflammatory drug that will bother their stomach or increase their risk of coronary artery disease or shut their kidneys down or drive their blood pressure up, the anti-inflammatories. Maybe they know that's not the option for them, so they just endure it. The fact that medications for osteoarthritis calm inflammation and pain, but they do not improve joint health. The ibuprofens, the Celebrexes, the aspirins, they calm the inflammatory reaction, but they do not improve joint health. In fact, when used over time on a regular basis, the anti-inflammatories actually erode the bone mineral density. They weaken your bones, and they decay the quality and integrity of the joint. Now, the occasional ibuprofen is not going to do this, but if you're in a pattern of every day treating your osteoarthritis pains with anti-inflammatories, you're running the risk of problems. Problems you don't need, and problems that are going to make your pain worse with time. Also, the medications used to treat osteoarthritis pain are among the medicines that have the highest side effect profile of all our medicines. Do you want to know what those medicines are that cause us more trouble than any? It's our most common ones. The non-steroidal anti-inflammatory drugs, antibiotics, side effect profile is high in all of these. The anticoagulants. We all know someone on an anticoagulant who's had a hemorrhage This is common. And then the diuretics used for blood pressure alters your blood minerals and electrolytes, your potassium and your calcium and magnesium. The anti-inflammatories are notorious for stomach irritation, ulcers, kidney and liver dysfunction. Even I know a man who had terrible arthritis, and he used high-dose ibuprofen every day for years, and he developed kidney cancer. Now, it's hard to prove that that caused it, but there is a correlation with anti-inflammatory use and kidney difficulties, including cancer of the urinary tract. So there is help aside from these medicines, and that's what we want to talk about today. Glucosamine, chondroitin, and MSM. These are nutrients for the joint. They help to soothe an aching joint. First is glucosamine and chondroitin. Let's talk about that. You know, we hear frequently disparaging comments on the quality and effectiveness of glucosamine. Two often cited studies suggest that glucosamine and chondroitin are not effective in treating osteoarthritis, and that glucosamine may even be damaging to the pancreas and raise the glucose levels. Glucosamine, it's glucose with an amine attached to it, but that amine attachment, which is a nitrogen-based functional group, that changes everything. It's no longer glucose. It doesn't raise the blood sugar, and our doses are so small. It's a gram and a half. That's a third to a half a teaspoon of glucose if it were even used that way, and it's not. That's not enough to have a sustainable raise in blood sugar in anybody, even the most brittle diabetic. It might raise a spike, but no. It doesn't raise glucose, and studies have shown that. The studies that show that glucosamine are ineffective for the treatment of osteoarthritis, they cherry pick their data and republish to suit their needs. You know, when you use test tube studies, that's the glucosamine and high blood glucose, and you increase the amount of glucosamine 15 times of what a human would take to get the benefit, you can't rely on those studies. These studies are designed and paid for by drug companies to keep you in the dark about natural agents. We're all familiar with this pattern. It permeates the natural world. It permeates all the dietary supplements, and I guess they're afraid of what really works. The pharmaceutical companies have a bit of fear with us because they see our momentum. They see our growing support, our growing crowds, that people have the ability to take care of themselves. What a novel idea. We're not dependent on the system. We're not dependent on drug companies and health insurance, and we can conduct our lives independent and free of that. What's so afraid and fearful of that notion? Yeah, it all comes down to money, doesn't it? The osteoarthritis market totals some $100 billion every year in this country, and the glucosamine, chondroitin, MSM accounts for less than $2 billion in sales, but it's growing quickly. Drug companies conduct studies that are designed to fail. We see it all the time. They will use inferior products, and then when that doesn't work, they make sweeping conclusions about glucosamine is worthless. Well, if you study the literature, you will find crystalline glucosamine is the agent that works. Now, what does that mean, crystalline? Crystalline implies that the substance can form crystals. And when you study chemistry, you learn for a substance to form a crystal, it needs to be pure. And glucosamine, when it's impure, tends to form long chains of glucosamine. They're all attached together. That's not glucosamine. The glucosamine that is crystalline is individual glucosamine units that form a crystalline structure. So it has to be pure. It has to be that molecule, and the overwhelming majority of those molecules has to be that one for it to even form a crystal. So when we use crystalline glucosamine, that's what works, not the inferior stuff. Now, we have a break coming up, so let's go to that. And when we come back, let's talk about the science on crystalline glucosamine. You may have heard the saying, an ounce of prevention is worth a pound of cure. It's true. I'm Dr. Richard Becker.
And I'm Cindy Becker. Autumn is a time of transition. It's the perfect time to renew your dedication to healthy living. This September, we're excited to bring you our fall savings celebration here at BioInnovations.
Perhaps you've heard about the health benefits of supplements. In many cases, they can make a big difference.
During September, Dr. Becker Spa Nutrients are up to 40% off. Noni Natural Skincare and Spa Therapy are 40% off. And Aloha, Noni, and Acai are still 50% off by the case. And you get free shipping with orders over $50 in the continental U.S.
This is a good time to restart a program of nutrition, exercise, and supplements because an ounce of prevention really is worth a pound of cure.
Order online or call 888-442-2128 and let BioInnovations assist you in making the right choices for better health. Ask about the AutoShip program for additional savings.
I'm Cindy Becker for Your Health at a Glance. We all have said, I need to get some exercise, but how many of us put on our walking shoes and go? Learning a little more about the health benefits of exercise may help you get motivated to lace up those walking shoes. Exercise helps to control our appetite and weight. It maintains strong muscles. It promotes the release of endorphins that counter depression while helping us feel good about our lives. Exercise helps to lower blood glucose, promotes a strong circulatory system, and controls cholesterol. Exercise even helps us get a good night's sleep. Recent research finds dog owners who regularly walk their pet are 34% more likely to achieve fitness goals. You can get all of these health benefits by walking 30 minutes 4 times a week, just 30 minutes a day. Start today, and you'll start to get all those benefits. For Your Health at a Glance, I'm Cindy Becker.
Do you believe that nature holds the answer to your health needs? Are you looking for a supplement that's simple and pure, yet really works?
If you're looking for nature's answer to better health, look to Aloha Noni Juice. It's pure and fresh, just like nature intended. Aloha Noni Juice is brought to you direct from the islands of Polynesia.
Aloha Noni Juice is 100% pure with no added sugar or sweet fruit fillers. It's the perfect addition to your low-sugar diet.
Aloha Noni Juice drinkers will tell you their vitality, energy, and sense of well-being have improved, along with relief from many painful conditions. Made by nature, proven by science, Aloha Noni Juice contains only nature's best.
And now you can enjoy the benefits of our new 100% certified organic Noni Juice.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings.
We're back, everyone, learning how we can support our joints naturally. Isn't this interesting information? Especially learning the difference between the different types of glucosamine and the crystalline, as we call it. And that's, Richard, that's what you've always done. Was
Sign
you've
of quality,
always
sign
put
of
together,
purity.
right?
It absorbs better.
The crystalline glucosamine, but that doesn't mean that's what you find everywhere. But anyway, but the science that we're going through today is the crystalline, right?
Well, quality costs.
Right.
You get what you pay for, right? We've all learned that in life.
Yes, we have.
So that extra step, the purity, makes all the difference. Folks, there's overwhelming evidence that glucosamine, chondroitin, and MSM have benefits to the osteoarthritis patient. If we go to Google Scholar and we search glucosamine, double-blind, placebo-controlled, 12,000 entries pop up. 12,000 in the worldwide literature. That's a lot of research. If we do the same for chondroitin, 12,000 double-blind studies pop up. If we do that for MSM, 680 double-blind studies. That's a preponderance of evidence. So if somebody says to you, well, that glucosamine, chondroitin, MSM, there's no science on that. We don't know that much about it. It's unproven. They're years behind on their reading. And I really, you know, doctors, you show your ignorance when you make statements like that. Please don't do that. Just spend a little time in the natural world. You'll be amazed the benefits your patients will have. It's really quite something. Thousands of other scientific writings clarify their exact mechanisms and their safety profile. Well, we reviewed the literature for you. Glucosamine, chondroitin, and MSM are powerful agents that calm the inflammation and pain of arthritis while they slow down and even stop the destructive process of osteoarthritis, our most disabling health condition in America. What is glucosamine? This is the science, this is what we've learned. It is a natural form of amino sugar that plays a role in cartilage formation and repair. The cartilage, it's made up of this glucosamine. It does not raise your blood glucose level. It protects the joint surface. It helps to restore structure and function of the cartilage in our decaying joints. Here is its exact biological mechanism. I'm going to tell you this, and then I'll help and interpret it so we can all understand it. Glucosamine reduces interleukin-1 induced gene expression via inhibition of cytokine intracellular signaling cascade. It does this by inhibiting factor kappa beta activation. Now, what in the world does all that mean? As our joints decay, as we have the minor injuries of life and even the major injuries, say a broken ankle, a twisted knee, this type of thing, it does damage to the cartilaginous surfaces of our joints. When that damage occurs, it releases chemicals into the joint space. These chemicals are absorbed by the cells in the joint, the cartilaginous surfaces, and it sends a signal to the DNA of the cartilage that sends a signal back that releases inflammatory products that initiates the healing mechanism. But healing doesn't always work real well, and it ends in the destruction of the joint. Glucosamine inhibits that process, and they know exactly how it does it. So what they've learned is that glucosamine has anti-inflammatory properties. It creates a 28% reduction in inflammation. It has antioxidant properties that counters the free radicals of joint damage. And you know, once a normal joint surface is smooth, so smooth, it's one of the slipperiest surfaces ever encountered by engineers. It is 7 times slipperier than ice on ice. That is a smooth, slick surface. But when you damage that surface, it develops a cauliflower-like surface. It's no longer smooth glass on glass, it's knobby on knobby. And so every time you move it, you're causing a little damage because it's not that smooth, slick surface anymore. Does that make sense? I want everybody to understand it because it all makes sense if you understand. And every time you move it, that damage, that pain you feel, is a sign that those chemicals are being released that end in more inflammation and more damage. So by the end of the day, that knee is really aching, isn't it? You know how it goes because you do this every day. You endure it every day. They know how it works. Well, glucosamine stops this degenerative process. Isn't that wonderful? The non-steroidal anti-inflammatory drugs, ibuprofen, aspirin, do not stop this process. Doesn't do a thing for that. Doesn't do a thing. A review of the literature shows the crystalline glucosamine works. The other kinds, not so much. Not so much. The purity of crystalline glucosamine leads to high absorbability with no competing long-chain molecules of glucosamine that's hooked together. So the glucosamine is like the links in a chain, but they're all separated and individual. Impure glucosamine, those links hook up. And you can't absorb these long molecules. It gets used for something else, not to help your joints. Now, it's important that we all understand glucosamine is a product of shellfish. You take the shell and treat this, process it in a way to release this glucosamine. So if you are allergic to shellfish, extreme caution, I can't recommend you take glucosamine. I can't recommend you do it. Now, what about the science? What does the science say? An Australian researchers at Monash University conducted a 12-week study on 46 people with knee pain. 88% of the glucosamine, 88, that's almost 9 out of 10, said the knee pain had improved compared to only 17% in the placebo group. That's in the British Journal of Sports Medicine. A long-term study of 212 patients, 50 years of age and older, who received 1,500 milligrams of glucosamine, they found it halted the progression of joint damage, halted it, and reduced the symptoms of osteoarthritis. Next, we have 2 3-year studies, double-blind, placebo-controlled, involving 414 subjects, found those taking glucosamine showed no further joint space narrowing. This is what we call disease-modifying properties. This is what we're looking for in science. We don't want to just inhibit and calm the symptoms. We want to modify the disease course and cure it if we can. And I'm not calling glucosamine a cure, but that's our goal. That's what we're looking for. Glucosamine, next study, exhibits cartilage protective effects on the joints. It protects the joints. International Journal of Molecular Medicine. You can read that. Go to the journal and read it. Also, we see glucosamine sodium and glucosamine potassium. Now, sodium is part of salt, right? And it is the part of salt that raises our blood pressure. So it's a good idea that we keep our salt intake at check. So if you're a heart patient, say perhaps you have heart failure, you wouldn't want to add extra sodium to your diet. So they've even found, studying, comparing glucosamine sodium with glucosamine potassium. Potassium is good for us. It helps to keep that blood pressure down. It keeps the heart in good shape, whereas sodium can have a negative effect. Well, we've learned that glucosamine potassium is just as effective as the more common, cheaper glucosamine sodium. So this is all good. Disease-modifying properties. You know, that's the big turn of events in cancer therapy. We want to modify the progression of the cancer, and the autoimmune arthritises. But glucosamine's had it all along. Now, we're going to a break, but when we return, the science on chondroitin. We'll be back. You may have heard the saying, an ounce of prevention is worth a pound of cure. It's true. I'm Dr. Richard Becker.
And I'm Cindy Becker. Autumn is a time of transition. It's the perfect time to renew your dedication to healthy living. This September, we're excited to bring you our fall savings celebration here at BioInnovations.
Perhaps you've heard about the health benefits of supplements. In many cases, they can make a big difference.
During September, Dr. Becker's Spa Nutrients are up to 40% off. Noni Natural Skincare and Spa Therapy are 40% off. And Aloha, Noni, and Acai are still 50% off by the case. And you get free shipping with orders over $50 in the continental U.S.
This is a good time to restart a program of nutrition, exercise, and supplements, because an ounce of prevention really is worth a pound of cure.
Order online or call 888-442-2128 and let BioInnovations assist you in making the right choices for better health. Ask about the AutoShip program for additional savings.
I'm Dr. Richard Becker for Your Health at a Glance. Does acid reflux keep you hooked on antacids? If so, you may be suffering from GERD, which stands for gastroesophageal reflux disease. GERD affects at least 20% of the adult population. In fact, Americans spend hundreds of millions of dollars per year on medicines to treat GERD. This is unfortunate because these medications have side effects. They can cause additional digestive problems, and they lead to nutrient deficiencies, such as the depletion of vitamin B12. Fortunately, there are simple lifestyle changes that can reduce the symptoms of GERD. Avoid lying down or exercising within 2 hours of eating. Lose weight because obesity worsens symptoms. Limit foods that cause GERD, such as fried, fatty foods, mints, chocolate, and caffeine. To improve digestion, eat a diet rich in fiber, yogurt, and drink lots of water. For Your Health at a Glance, I'm Dr. Richard Becker. Have you heard of Cordyceps sinensis, the medicinal mushroom that supports metabolic processes for stimulant-free energy? This remarkable mushroom also supports the immune and respiratory systems, as well as the heart and lungs.
BioInnovations brings you Dr. Becker's Bionutrients, Cordyceps sinensis.
Medicinal mushrooms contain beta-glucans, compounds that promote healthy immune function while helping to coordinate multiple body systems. And Cordyceps sinensis is among the safest and most powerful medicinal mushrooms available today, making it your choice for stimulant-free natural energy.
BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-2128. That's 888-442-2128. Or order online at bioinnovations.net. Be sure to ask about the AutoShip program for additional savings.
We're back, everyone, discussing how we can naturally support our joint health with glucosamine, chondroitin, MSM, and other nutrients. Just amazing information. And to help you, I've got to let you know, it is Fall Savings Celebration at BioInnovations. fantastic prices, a great time to get these nutrients so you can have healthy joints and stop that pain once and for all. Great prices and free shipping on your orders over $50 in the mainland USA, so that's even another reason why you should get your orders early. So Richard, that was a lot on glucosamine.
Right.
Now we turn to its counterpart, chondroitin.
Chondroitin.
I like these together. I always think of them as
It makes
together
the
anyway.
most sense as you study through this to do a complete holistic package as best as possible in whatever
Right.
we do. What is chondroitin? Well, this is a large alternating carbohydrate chain. See, we wanted to avoid the chain in glucosamine, but in chondroitin, we want that chain. And it is a glucose-type molecule. It's a carbohydrate that's attached to a protein. And so this long chain of chondroitin, in essence, makes a spring-like molecule. Pretty neat, huh? And so we take this chondroitin from beef bones, beef cartilage, just as Jell-O is taken from beef bones and cartilage. So it is a bovine origin. But it is naturally found in our cartilage, in our bone, in the cornea of the eye, our skin, and arterial wall. So this is not foreign to us. We have this in our bodies. This compound, this chondroitin, this chain, blocks enzymes that can destroy cartilage tissue. Now we're in a constant state of renewal. Rebuild, destroy. It's a recycling process. The body naturally does this. It just makes sense. But if the destructive mechanism exceeds the ability of the building mechanism, you got joint problems and you're going to hurt. And it's not helping the arthritis. In fact, it's promoting the arthritis. So the chondroitin provides substance to a cushiony effect to the cartilage. It also helps to retain water in the cartilage. And since it's a springy type molecule, it creates a cushion effect between the joints. Haven't you noticed that? Those of you with degenerative disc disease and arthritis of the knees, the ankles, the hips, it just feels like there's no cushion left in there. It's just hard bone on bone and it grinds and ouch. Well, that's what we're trying to avoid. We want to get to this before it is bone on bone. Chondroitin increases joint mobility and slows cartilage loss. It protects the inside of the cartilage. So the glucosamine is the outer shell, and the chondroitin is the inner substance. So now we have a strong cartilaginous surface and substance that has a high water content that creates a cushion and protects the joint from that bone-on-bone damage. The effect of chondroitin, when taken orally, lasts longer than any of the non-steroidal anti-inflammatory drugs. The dose is about 1,200 milligrams a day. That is the studied dose that's found to be most effective. The glucosamine dose is 1,500 milligrams a day. You can take up to 3,000 milligrams a day of glucosamine, but after 1,500, you're not as absorbing as much, and there's not much extra benefit unless you're a very large person, 6'6", 290 pounds, like an NFL lineman. You would want to take a little extra. But for most of us average-sized people, you don't need these huge doses. There's not that much extra benefit. Chondroitin improves function and decreases pain and osteoarthritis of the hands, knees, ankles, hips, shoulders. It's all been studied. It's all the same process. It's just different joints, and there are little subtle differences, but it works on all of these. Osteoarthritis and cartilage. Here's a study, 120 osteoarthritis subjects, double-blind, placebo-controlled, chondroitin sulfate. They found it decreases pain and improves joint function while stopping disease progression. It does more than the anti-inflammatories, just like glucose. This is individual. No glucosamine at all now in these studies. We're just looking at chondroitin. 6 months of chondroitin in another study reduced cartilage volume loss. 12 months reduced bone marrow lesions. This is in the Annals of Rheumatic Disease, the journal. This is a big thing. We see in the more advanced osteoarthritis little cauliflower-like patterns inside the bone, not just on the surface, but eventually that osteoarthritis process affects the bone substance itself. And now that person really is hurting. That's a tough one. But chondroitin reduces that bone marrow lesion appearance. Very helpful. University of Washington, chondroitin alone outperforms fish oil or glucosamine for lowering full body inflammation. So it too, the chondroitin is also an anti-inflammatory. Chondroitin improves knee pain and plaque formation in psoriasis patients. This is in osteoarthritis, the journal. Helps psoriatic arthritis. You ever heard of that, folks? Psoriasis on the skin, but with the arthritis, it affects, the autoimmune affects the joints too. This is something I want everybody to understand. The glucosamine chondroitin, due to its anti-inflammatory and joint protective qualities, helps autoimmune arthritis as well. We think of it as for osteoarthritis, but it's been my experience, and the studies are there too. It can be helpful in the rheumatic arthritises. Now, combining chondroitin and glucosamine is the best effect of all. Let's go to our break. Can we do that? And when we return, let's talk about the studies on when we combine these agents. And don't forget, we have MSM too. We'll be right back. You may have heard the saying, an ounce of prevention is worth a pound of cure. It's true. I'm Dr. Richard Becker.
And I'm Cindy Becker. Autumn is a time of transition. It's the perfect time to renew your dedication to healthy living. This September, we're excited to bring you our fall savings celebration here at BioInnovations.
Perhaps you've heard about the health benefits of supplements. In many cases, they can make a big difference.
During September, Dr. Becker's Bionutrients are up to 40% off. Noni Natural Skincare and Spa Therapy are 40% off. And Aloha, Noni, and Acai are still 50% off by the case. And you get free shipping with orders over $50 in the continental U.S.
This is a good time to restart a program of nutrition, exercise, and supplements, because an ounce of prevention really is worth a pound of cure.
Order online or call 888-442-2128 and let BioInnovations assist you in making the right choices for better health. Ask about the AutoShip program for additional savings.
For many of us, the days pass on by. Whether it's living for the weekend, waiting till the kids come home, or waiting for whatever is next, don't waste your life waiting on tomorrow when there is still today. Benjamin Franklin said, "Do you love life? Then do not squander time, for that's the stuff life is made of." The Lord did not give us today to sit and wait on tomorrow. What we do today shapes our tomorrows. As David wrote in Psalm 90:12, "Teach us to number our days, that we may gain a heart of wisdom."
Vitamin D deficiency is at epidemic levels in the United States. Chances are you aren't getting enough of this essential nutrient. Vitamin D is one of the most important molecules in the human body. It's required for the proper function of nearly 4,000 genes and 1,000 metabolic chemical reactions.
BioInnovations brings you Dr. Becker's Bionutrients Vitamin D3. Now, supplementing with vitamin D is safe and affordable.
Studies show that vitamin D deficiency can lead to poor immune function, depression, cardiovascular disease, bone disease, diabetes, cancer, and much more. Starting supplementing vitamin D today for better health tomorrow.
BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. So give us a call at 888-442-2128. That's 888-442-2128. Or order online at bioinnovations.net.
We're back, everyone. Just a quick reminder, it is fall savings celebration at BioInnovations. Fantastic prices. I mean, really great prices. And free shipping on your orders over $50 in the mainland USA, so don't miss out. So, Richard, I always think of glucosamine and chondroitin together. We had compelling information about them separately, but putting them together, what synergistic effect do we get?
Well, there was a trial done, it's called the GATE trial, and this was supposed to answer all the questions on the efficacy of these agents, and they found that when you combine glucosamine and chondroitin, they outperformed Celebrex for the use of osteoarthritis. 80% found relief of their pain from this combination. Now, they reshuffled the deck after millions of Americans went to the health food store to get glucosamine and chondroitin because it was hurting the drug sales. I've watched this unfold, and then they rearranged their data so it appeared as it didn't really work at all. And I wonder if they didn't even use crystalline glucosamine, because when I read their report, they didn't mention anything about the specificity of crystalline glucosamine, which all the other research acknowledges. This is the one that works. Why aren't you using it? If it answers all the questions in your study, why don't you use the real deal? Good question. See, folks, don't fall for that stuff. Is it easier to believe that doesn't work or review 24,000 research articles in highly technical language? Which is easier to do and understand and master? It's easier to say, oh, that doesn't work. And this is the pattern of humans. We swallow that type of thing because it relieves our burden of knowledge. But for your lack of knowledge shall you perish. You've heard that. I know you have. It's true. The more you know, the better quality of your life. So we have multiple studies. A review of 28 previous studies on glucosamine and chondroitin shows the relief of arthritis pain while improving joint function and preserving joint structure. There's so much evidence on it today. Combining them works best, especially when you use the crystalline glucosamine. Our third agent is methylsulfonylmethane. Let's just call it MSM. That's what it stands for, methylsulfonylmethane, MSM. This is an organic source of sulfur. It is needed for strong connective tissues. The MSM relieves pain and inflammation on its own. It helps to modulate autoimmune disorders and autoimmune arthritis. It calms them down, helps to repair damaged muscle. Often there is damage to muscle along with the joint in these injuries. It improves sleep, especially in the arthritic patient. You know what I'm talking about. You're ready for sleep, you're ready to go, but that knee or neck or shoulder or whatever, the achy part just keeps throbbing away. You're not going to sleep so easy, buddy. No, you're not. Well, MSM calms that down to help you fall asleep. Typical recommended dose is anywhere from 1 to 3 grams daily, and you can take MSM as a source of sulfur if you're allergic to shellfish. No problem there. But the glucosamine, you be careful. I wouldn't do that. I can't recommend that. Osteoarthritis and cartilage, this is a medical journal. 50 subjects with osteoarthritis, double-blind, placebo-controlled study, MSM 3 grams a day. It improves the symptoms of pain and physical dysfunction in osteoarthritis with no significant side effects in any of the subjects. So that's always good to hear. And any of these agents, glucosamine, chondroitin, MSM, can be taken with your medications, your anti-inflammatories, specifically the or even a narcotic pain medicine if your pain is that bad. It can be taken with that, not a problem. Kasturba Medical College in India, 12 weeks of MSM, 40% reduction in pain, 28% improved mobility, and 75% reduction in pain medicine. Wouldn't that be nice if we don't have to take the ibuprofen every single day? So you're not subject to these long-term side effects of heart disease, kidney problems, and what. Occasionally, you know, once a week, maybe once every 2 weeks, I take a dose of ibuprofen, then I'm fine. But I don't have to take it every day anymore. Wouldn't that be welcome news? A review of 20 studies on MSM, glucosamine and chondroitin together, even that combination has been provided. Between 50 to 80% reduction in pain in osteoarthritis patients. So, there you have that. The combination of glucosamine, chondroitin, and MSM leads to increased aerobic function. We can get around better. That's what we mean by that. Lowered knee pain and disease modification. It halts the progression. Now, let's go to our break here. But in the interest of holism, I want to return and give you the other dietary supplements and lifestyle practices when added to our glucosamine, chondroitin, and MSM that are really going to help bring relief to your chronic pain. We'll be right back for that list. You may have heard the saying, an ounce of prevention is worth a pound of cure. It's true. I'm Dr. Richard Becker.
And I'm Cindy Becker. Autumn is a time of transition. It's the perfect time to renew your dedication to healthy living. This September, we're excited to bring you our fall savings celebration here at BioInnovations.
Perhaps you've heard about the health benefits of supplements. In many cases, they can make a big difference.
During September, Dr. Becker's Spa Nutrients are up to 40% off. Noni Natural Skincare and Spa Therapy are 40% off. And Aloha, Noni, and Acai are still 50% off by the case. And you get free shipping with orders over $50 in the continental U.S.
This is a good time to restart a program of nutrition, exercise, and supplements because an ounce of prevention really is worth a pound of cure.
Order online or call 888-442-2128 and let BioInnovations assist you in making the right choices for better health. Ask about the AutoShip program for additional savings.
I'm Cindy Becker for Your Health at a Glance. Do you like to exercise outdoors? Many consider gardening one of life's most rewarding activities. The American Heart Association says gardening promotes a strong heart and it helps to preserve brain mass in seniors. Follow these guidelines so your gardening experience will be enjoyable for years to come. Wear a wide-brimmed hat and protect your skin from too much sun. Wear gloves and sunglasses even on cloudy days. Make your posture strong by bending from the knees. Consider wearing knee pads. Start with small jobs. Set a gentle pace and ask for help when moving heavy objects. Pause frequently and drink lots of water. Whether it's trimming bushes, cutting grass, or growing nutritious vegetables, gardening is a great way to get your exercise and get back to the earth. For Your Health at a Glance, I'm Cindy Becker.
Is your life out of balance? It may be. The average American consumes far too many omega-6s and not enough omega-3s. This creates an imbalance.
So what can we do to get back in balance? We can eat a healthy diet.
And most of us need to supplement with omega-3 rich fish oil. Fish oil contains omega-3s with DHA and EPA, fatty acids that promote good brain and heart health. So reduce omega-6 in your nutritional plan and boost omega-3 to get back in balance.
To help you do that, BioInnovations offers two products, the Fish Oil Complex and Omega-369, both formulated for your health and well-being. So how do you choose? For highest levels of DHA and EPA, choose the Fish Oil Complex. For a balanced formula, choose the 369.
Go online at bioinnovations.net or call 888-442-2128. Ask about the AutoShip program for additional savings. Your Health is brought to you by BioInnovations, trusted products for your health and well-being.
We're back, everyone. This hour is just flying by, isn't it? Such important information. And I've got to tell you, this is really, really great. When we put together the glucosamine, the chondroitin, and the MSM, we do get the synergistic effect. And Richard, the way we put this together, I've got to say, it really works. And I found that the other products that I've taken before, because I have always supplemented with these since I've been active, riding the horses and doing athletic things, that this product is easy to tolerate.
It is.
I find that it doesn't cause stomach upset, even though, I mean, it's better to take it with a little food, but it's not those that leave you with that acid stomach type.
Right. Yeah, it's very well tolerated. And to get the full effect, the maximum benefit from this product, it's 4 capsules a day. It seems like a lot, but it really isn't. You know, our dogs, we love our dogs, and our dogs chew the bone. Dogs get their glucosamine, chondroitin, MSM by chewing on bones. Well, we don't want you to have to do that. You just got to swallow the pills.
I know, I started taking 3 capsules, and you made me, you kept saying, no, Cindy, you need to do it. Oh, you're just telling me that, Richard. No, you made me take 4, and wow, it worked.
I want you to get pain relief.
That's right.
I don't want you to waste the product.
That's right.
Get the best out of it.
Okay.
Now, what else can we do? Fish oil. Here's something interesting. University of Pittsburgh Neurosurgery Department found that 60% of those with disc pain, and disc pain often accompanied with osteoarthritis and nerve pain, 60% could stop their nonsteroidal anti-inflammatories after 30 days if they just took omega-3 dietary supplement, fish oil. Fish oil helps pain. It calms inflammation. University of Michigan, omega-3s calm pain and inflammation by decreasing prostaglandins. We know exactly how it works. A study of 66 patients with rheumatoid arthritis found taking omega-3s led to a 3 and 6s together, the right kind of 6s, a 40% reduction in the number and severity of swollen joints. That's a pretty powerful thing as an add-on benefit to your coronary artery disease prevention program with the fish oil. That's just good all the way around. Next is noni juice, 70% as effective as a dose of morphine, but no narcotic, no sedation, no dependency. Amazing stuff, noni, for pain. A little shot in the morning. If you're aching at night and you need a little extra help, take a little more at night. It won't hurt you. And there's so many other benefits as well. Calms inflammation. Vitamin D, this is so critical. Researchers found early on that people low in vitamin D are much more likely to live their life in chronic pain. Now, there are so many benefits to vitamin D. I'd hate you to lose out, but this one, the connection between chronic pain, joint dysfunction, joint pain, osteoarthritis, and vitamin D is profound. I saw it in my practice every day. Every day, when we nourish people properly, got their vitamin D level up and their B vitamins, their calcium, their magnesium, they began to heal out of pain. So what does this create? What we're talking about, folks, you may be in a state of stalled healing. The injury occurred years ago, but you've never had the proper nutrient levels in your body so that you could finish the healing. Don't be stuck in that. Heal, get over this. It really makes a difference. Get your vitamin D level up. Take your vitamin C, multiple minerals, multiple vitamin. Give your body what it needs to heal. Next, boswellia, the frankincense herb. Tremendous anti-inflammatory properties. Take it, this is a biblical herb, folks. That alone should raise your interest. Well, if it's so important that it was a gift to the Christ child, what tremendous benefits could it provide for us? I think it was included in that way to give us a message. Pay attention to boswellia or frankincense. Curcumin, the powerful anti-inflammatory antioxidant. Royal jelly can help the arthritis patient. Cherry fruit extract for the gout patient. You know, gout flares. In our use of high fructose corn syrup and chronic dehydration in this country, which can cause pain in and of itself, has caused a tremendous increase of gout in recent years. Boy, just take some cherry fruit extract every day, drink more water, and get citrate. And you get that from citrus fruits. A little orange juice, a little lemonade, a little grapefruit juice every day. Citrate helps the gout patient, fluids help the gout patient, and cherry fruit extract. Your B vitamins, don't forget your topical and systemic magnesium. That's part of that mineral package. pH correction. If you're running acidic, every single bit of arthritis is going to scream. Alkalinize your system, get it up to the normal levels where it's supposed to do. And how do we do this? By eating a healthy diet, fruits and vegetables, plenty of water, and alkalinizing minerals. This is another reason why the minerals are so important. A good mixture, you know, we have the coral calcium and the mineral blend from the sea. That's a good way for alkalinizing your system. It's a good way to do it. Hyaluronic acid is another long chain without sulfur that is used in our cartilage and connective tissues. Hydration, and chronic infections. If there is any chronic infection, chronic sinus, dysbiosis, that creates an inflammatory reaction throughout the body that just keeps the joints on fire. Treat the dysbiosis, treat the chronic sinus, chronic urinary tract, and any of those infections, get them under control. And don't forget daily exercise, keep the joints moving, and do not ever forget to thank God for your many blessings. Thank you for your kind attention. We'll see you tomorrow, folks. Bye-bye.
Thanks, everyone. We'll see you tomorrow right here on Your Health.
You know, sometimes I think that our standards are so high for who we want to get elected that if we don't make those standards, we think we've lost. I'm not really sure I can get somebody who's like me. I'm not even sure I can get somebody who's for me, but I'm pretty sure I can get somebody who's not against me. We have to get to the polls and get somebody who won't be against us.
Make the pledge to vote. Visit myfaithvotes.com.
Every single day brings us closer to the epic finale of the universe, the return of Jesus Christ. But for those who know Christ, the ending is only the beginning. Hi, I'm Robert Jefferson. This month on Pathway to Victory, we're conducting an in-depth study of the book of Revelation. How should the truth of